Usually when we talk about a medical diagnosis, there's this expectation of like mechanical precision.
Right, yeah.
You break your arm, the x-ray reveals a jagged white line, and the doctor just points at the screen and says, well, there it is.
Exactly. Broken or not broken.
Right. It's a clean, visible, and ultimately comforting binary.
Yeah, we have a really deep cultural preference for things that can be, immediately visualized and just neatly
We
categorized.
totally do. But the second you step into the world of internal systemic illnesses or chronic fatigue or neurodevelopment, that reliable x-ray machine suddenly isn't much help.
No, not at all.
You find yourself in this diagnostic landscape that is entirely invisible. So how do you diagnose what you cannot see without, cutting a person open?
It's a great question.
Today's deep dive is about decoding the body's hidden language. We are examining two incredibly dense clinical texts on traditional Chinese medicine, specifically focusing on diagnostic observation.
It is just fascinating material.
It really is. It's fascinating to step outside our modern Western framework for a minute, not to throw away our MRIs, obviously, but to look at this purely as a brilliant piece of historical observational science.
Right? We're just impartially exploring how they viewed the body.
Exactly, because
Okay.
these texts treat the human face and body almost like a dashboard.
A dashboard built on literally thousands of years of pattern recognition. I mean, the foundational premise of these texts provides a radically different perspective on human anatomy.
Yeah, completely different.
Instead of viewing the body as a collection of, isolated mechanical parts, this framework operates on the principle that absolutely nothing on the surface of the body happens independently of the internal organs.
Okay, let's unpack this core mechanism because
Yeah.
the texts keep referencing this concept of Zhangfu.
Yes, the Zhangfu.
They argue that the internal state of your organs, the Zhangfu, visibly reflects on the exterior, particularly the five sense organs.
Hmm.
But what is the actual physical pathway there? Like, how does a distressed internal organ manage to send a distress signal to, say, the tip of your nose?
So the underlying logic relies on a continuous network of meridians and channels.
Okay.
Think of them like a highly complex internal fiber optic network or maybe an underground river system.
Underground rivers, I like that.
Right. And the internal organs act as the major reservoirs. When an organ is functioning perfectly, it pumps vital energy, what they call qi and blood, through these channels to nourish the surface of the body.
Oh, I see.
But if there is, say, a toxic spill or blockage in that deep internal reservoir, the effects will inevitably ripple outward.
So they bubble up to the surface.
Yeah, exactly. A trained observer doesn't need to look at the internal organ itself. They just need to look at the color and texture of the water reaching the surface.
Wow. Which means whether you, the listener, are just insanely curious about historical medical systems, or you just want to understand your own physical baseline a bit better, this deep dive is going to completely change how you look in the mirror.
Oh, totally. You won't be able to unsee it.
You'll start seeing these surface reflections everywhere. But before the texts even get to the specific facial features, they start with the widest possible lens, like the macro view of a person's overall physical presence.
Yeah, they look at the general shape, posture, and movement before zooming in at all.
Right.
And the rationale is that this macro view gives you the broad, energetic state of the patient. For instance, the texts describe how an overweight body type combined with mental depression points to a deficiency of qi and an accumulation of phlegm dampness.
Okay, yeah, that phrase, phlegm dampness, it pops up a lot in the sources, and it sounds a bit jarring to a modern ear.
It does sound pretty gross, honestly.
Yeah, a little bit.
But in this context, it doesn't just mean respiratory mucus. Dampness in this framework is a way to describe metabolic sluggishness.
Okay, metabolic sluggishness.
Imagine a swamp. When the body's digestive energy, or spleen qi, isn't strong enough to process fluids and nutrients efficiently, those fluids just sort of stagnate and become heavy or damp.
Like water pooling in a swamp.
Right. And over time, this dampness congeals into phlegm, which slows down the body's systems, creating that physical heaviness and mental brain fog the text describes.
That makes a lot of sense. The texts also categorize movement and posture as diagnostic data points, which is super interesting.
Yeah, they do.
Active, restless movements are categorized as yang, indicating heat or excess. Passive, withdrawn movements are yin. And the specific posture examples really caught my attention.
Oh, like the neck posture.
Yes, if a person is sitting with their neck extended and their head thrown back, the text associates this with an excess of lung phlegm.
Because, intuitively, the body is desperately trying to open the airway.
Wow.
By contrast, if a person is sitting slumped, facing downward and avoiding conversation, the system reads that not as shyness, but as a severe qi deficiency.
So they literally don't have the energy.
Exactly. The body literally lacks the foundational energy required to hold itself upright and project the voice.
And they apply this to the complexion too, right? Like a lustrous, moist face means a good prognosis, while a dark, haggard face means a severe illness.
Yep. Even the body's secretions tell a story. Clear or white secretions indicate cold or deficiency, whereas turbid, yellow secretions mean there's excess or heat in the system.
See, I have to push back on this a little bit.
Okay, go for it.
Are we saying a person's underlying personality, maybe they're just naturally a quiet, introspective person, or their momentary sluggishness on a rainy Tuesday is being read as a medical symptom?
Well,
I mean, it feels akin to trying to read a car's overall performance just by listening to the engine hum, rather than plugging in the diagnostic computer.
if we connect this to the bigger picture, to understand why they do this, we have to look at a core concept called Shen,
Shen.
which loosely translates to mind or spirit. In this framework, the mind and the body lack the hard, impenetrable boundary we often assume exists today.
Okay, they're connected.
They are two sides of the exact same coin. Shen is the vitality behind the eyes. It's the body's overall outward radiance.
So the engine hum.
Precisely. A mechanic trained to listen to that hum can hear microscopic misfires before a warning light ever turns on.
Oh, that's a great point.
Momentary sluggishness is just the weather. But prolonged, deep emotional problems like chronic grief or severe stress are treated as physical forces.
Really? Physical force.
Yes. The texts argue that long-term emotional distress directly consumes the essence of the internal organs. If a person's eyes are persistently clouded and dull, it isn't just a sign that they are sad.
Right.
It is a clinical indicator that their internal vitality, their Shen, has been fundamentally weakened. The mind's disturbance is physically exhausting the body's core.
That is just wow. The transition from that macro holistic view to the micro details is where this gets completely mind-bending.
Oh, absolutely.
Because the texts move from the overall Shen straight to the most expressive features on the eyes and the ears. And they treat the eye not just as a window to the soul, but as a literal anatomical map of the internal organs.
The foundational rule here is that the liver opens into the eyes, meaning your liver health dictates overall vision and eye clarity. But the detailed mapping goes much deeper than that.
Right.
The physiological mechanism is that the essential qi of all the internal organs flows up to nourish the eyes.
The breakdown they provide is incredibly specific. The corners of the eye relate to the heart. The upper eyelid maps to the spleen, and the lower eyelid maps to the stomach.
Exactly.
The sclera, the white part of the eye, connects to the lungs. The iris belongs to the liver, and the deep dark pupil is governed by the kidneys.
Let's look at why the pupil connects to the kidneys, because it's super interesting.
Yeah, please.
In this framework, the kidneys are the foundational root of the body's fluid and essence. They are associated with the water element, deep reserves, and darkness.
Okay, darkness.
The pupil, being the deepest, darkest void of the eye that lets light in, is the physical manifestation of that deep kidney essence on the surface.
That is so poetic, honestly.
It really is. So when a practitioner looks at a swelling under the eye, they aren't just seeing a bad night of sleep. Since that lower eyelid area maps to the digestive and fluid systems, a puffiness there specifically indicates the kidneys are failing to regulate water properly.
So next time you wake up with puffy eyes or red corners, think about it. TCM interprets these not just as a bad night's sleep, but as specific organ feedback.
Exactly. Red corners would mean heart fire, by the way.
Heart fire, wow.
Ugh.
And here's where it gets really interesting. The source material pulls in modern research that completely shifts the scale of this.
The Fujian College study.
Yes. There's a study detailed in the text from the Fujian College of Traditional Chinese Medicine. They took this eye mapping and got unbelievably granular with it. They found that the sclera, the white of the eye, can reflect actual localized physical lesions of the back and chest.
It is a masterclass in reading those internal fiber optic cables we mentioned earlier.
Yeah.
They visually bisect the eye with a horizontal line. The upper half of the sclera reflects the back of the patient's body, and the lower half reflects the chest.
So it's a literal map.
Yes. And the right eye corresponds to the right side of the body, and the left eye to the left.
And they aren't just looking for general redness or irritation. They are looking for highly specific shapes and colors to determine the nature of the injury.
The detail they recorded is astonishing. The researchers identified deep black spots that resemble, like, little black sesame seeds in the whites of the eyes.
Black sesame seeds.
Yeah. According to their clinical findings, these tiny black spots indicate an injury that has caused a physical stasis of blood. It means there is a deep organic trauma.
But if the doctor looks in your eye and sees spots that are gray and scattered, looking more like tiny clouds, well, wait, that indicates an injury causing a stagnation of qi, right?
Exactly. Meaning there is an injury and pain, but without a deep, pooling physical lesion.
Okay.
It's an energetic block rather than a physical bruise.
The mechanism here is just profound. A physical trauma to the back disrupts the flow of blood and energy in that specific area.
Right, because the meridian network is a closed loop. So that localized blockage sends a chaotic ripple up the channel, which eventually deposits a microscopic pigment change in the corresponding zone of the eye.
That is wild.
And if those black sesame seed spots have a gray, cloud-like halo around them, it tells the doctor that both the physical blood and the energetic qi have been injured.
Just imagine the level of observational patience required for a practitioner to look closely into your eye, spot a tiny black dot with a gray halo in the upper half of your right sclera, and confidently diagnose a severe blood-stagnating injury on the right side of your back.
It's incredible.
It is a completely non-invasive visual diagnostic interface. And before we move on, I want to briefly touch on the ears.
Oh, right. The ears are crucial.
The sources say size and texture matter. Long, full earlobes mean a strong constitution. But dry, withered black lobes indicate an exhaustion of kidney qi.
Yep. And purulent discharge, which they call tinner, means damp heat of the liver or gallbladder.
Wow. And that precise methodology travels down the rest of the face, right? Following the map, we reach the orifices tied directly to the digestive and respiratory systems.
Right, moving downward to the nose, the mouth, and the throat.
The nose section really highlights how these systems interact. The texts state that the bridge of the nose reflects the liver, while the tip of the nose reflects the spleen.
Yes.
So if the tip is red, it's a straightforward indicator of heat in the spleen and lungs. And flapping nostrils means extreme lung heat.
But what's fascinating here is how the text also introduces the concept of the 5 elements: wood, fire, earth, metal, and water.
Right, the 5 elements.
This isn't just philosophical poetry. It's a diagnostic algorithm for how organs support or destroy each other. The liver is associated with wood, and the spleen is associated with earth.
So the sources mention that if the tip of the nose, which belongs to the spleen, turns greenish, it's a critical diagnostic sign, because green is the color of the liver.
Exactly. In the 5-element cycle, wood can overact on or invade earth. Think of tree roots aggressively breaking apart the soil.
Oh, that's a great visual.
So if a practitioner sees a greenish hue on the spleen's designated territory on the nose, they immediately know the spleen issue is secondary.
Because the liver is invading.
Right. The digestive system is failing because the liver is energetically invading it. The root cause is actually the liver.
It's essentially treating the tip of the nose as a localized weather radar for the spleen.
I love that analogy.
The colors act like radar blobs showing different weather fronts moving in. Blue indicates a cold front, usually accompanied by abdominal pain.
Right.
Red shows a heat wave. Gray indicates an impairment of water movement, like a stagnant storm system. And green shows an entirely different organ system crossing the border and invading the area.
That radar analogy applies perfectly as we move down to the teeth and gums, too.
Oh, yeah.
In this framework, the gums are influenced directly by the stomach. Swollen, bleeding gums are a blatant sign of stomach fire, which is excess heat rising up the digestive tract.
But the lips and mouth have their own indicators. Pale lips equal a blood or yang deficiency, while a greenish color around the mouth means liver blood stasis. And just breathing through an open mouth suggests lung qi deficiency.
Exactly. But going back to the mouth interior, the teeth actually belong to a different system entirely than the gums. The texts refer to the teeth as an extension of the bones.
Extension of the bones, that's so metal.
It is. And because the kidneys are responsible for storing the deepest essence of the body, that essence produces marrow, which in turn creates bone.
Okay, following.
Therefore, the teeth are the visible, outermost tips of the skeletal system, completely governed by kidney health.
This leads to one of the most interesting terms in the sources, empty heat.
Empty heat, yes.
The text states that if the teeth are dry and grayish, looking like dead bones, it indicates empty heat from kidney indeficiency. But what exactly does empty heat mean physically?
Think of the body like a car engine.
Okay.
A normal heat condition like a fever or an infection
Yeah.
is like revving the engine too hard. It's creating excess heat.
Right, standard overheating.
But empty heat is different.
Right.
It happens when the engine has completely run out of coolant, which is the body's yin, its cooling, moistening reserves.
Oh, wow.
The engine isn't necessarily being revved hard, but it is overheating because the coolant is gone. The friction creates a hollow, devastating kind of heat that slowly bakes the fluids out of the body, which is why the teeth turn dry, gray, and brittle.
That makes so much sense. It's heat born from exhaustion, not from excess.
Precisely. And just to round out the throat area, they look at the tonsils and pharynx. Grayish false membranes that are hard to peel and bleed immediately, that's diphtheria, which they view as lung heat consuming yin.
Wow. Incredibly specific.
And swollen tonsils of normal color in children just indicates a retention of dampness or phlegm.
So having decoded the entire face and head, the texts then track these organ energies as they flow outward into the extremities.
Yep. The limbs are the territory of the spleen and stomach. The mechanism is simple. The stomach receives the food, and the spleen extracts the vital essence and transports it outward to the muscles and forelimbs.
So if the spleen is strong, the muscles are firm and the limbs have stamina.
Exactly.
But when that transport system fails, the sources detail specific conditions like Bai syndrome, which is painful obstruction with joint swelling, versus Wei syndrome, which is weakness and atrophy.
Right.
And they detail edema or swelling in the limbs. They draw a really incredibly practical distinction between water edema and key edema.
Yes. Water edema is pitting. If you press your thumb into the swollen skin on a patient's leg, the indent stays there for a moment and the color blanches.
Like memory foam.
Basically, yeah.
Yeah.
This happens because there is a yang deficiency.
Mm.
The body lacks the metabolic heat to vaporize and move the fluids, so physical water just pools in the tissues.
Whereas key edema is non-pitting.
Right.
The skin is swollen, but if you press it, it bounces right back and doesn't hold the indent. This indicates key stagnation.
Great.
The energetic force is blocked, but physical water hasn't actually accumulated in the cellular tissue yet.
It's a purely tactile way to determine whether a blockage is energetic or fluid-based.
Oh,
And tremors in the hands, that indicates liver wind.
liver wind, wow.
Yeah, and Dupuytren contraction, where the ring or little finger curls inward in the elderly, they diagnose that as liver blood or yin deficiency.
The detail is endless, and this reliance on nonverbal, visual, and tactile signs reaches its absolute peak in pediatrics.
Oh, infant diagnosis is fascinating.
The diagnostic method for babies under 2 years old is just brilliant. I mean, an infant can't tell you where it hurts or describe the quality of their pain.
Exactly, they can't speak.
So practitioners look at the venules and the tiny superficial veins on the child's index finger.
They gently rub the baby's finger toward the body to make the veins more visible. Then they observe how far up the finger those veins extend. The joints of the index finger are divided into 3 distinct diagnostic thresholds.
The first joint, right at the base of the finger, is called the gate of wind. The middle joint is the gate of qi. And the top joint, right near the fingertip, is the gate of life.
The physiological principle here is that when a pathogen like a virus or a cold invades the body's defensive qi rallies to fight it.
Right.
In a baby, this battle forces the energy and blood into the superficial meridians of the extremities.
It functions exactly like a physical loading screen or like a progress bar for an illness.
That is exactly what it looks like.
If the visible discolored veins only push past the first joint, the gate of wind, the pathogen is still on the exterior of the body. It's a mild illness, like a common cold.
But if the pathogen is stronger than the child's defensive energy, it pushes deeper into the organ systems.
So the bar goes up.
Yep. On the finger, this manifests as the vein extending past that middle joint, the gate of qi,
The illness is now severe.
and internal. And if those visible veins push all the way up past the final joint, the gate of life, crossing into the fingertip itself, the text warns this is a critical, life-threatening situation. It's an immediate red alert.
The pathogen has breached the deepest defenses. And on top of tracking the progress bar, they also read the color of the veins. Blue indicates cold, which constricts the vessels. Red indicates heat, where the blood is moving rapidly. Oh, and they also look at the nar eminence, the base of the thumb, where blanche venules means stomach cold, and red means stomach heat.
It's so pragmatic. You
Mhm.
know, a doctor cannot ask a baby to describe their symptoms.
Yeah.
So the medical system developed these highly visual, nonverbal diagnostic tools.
It's so smart.
But all of these isolated signs, the swelling under the eyes, the green tint on the nose, the veins on an infant's finger, they generate a massive amount of clinical data.
A lot of data, yeah?
And human bodies are messy. A patient might have a red nose tip indicating heat, but pale lips indicating cold. When these external symptoms are chaotic and conflict with one another, how does the practitioner determine the true root cause?
They turn to the ultimate tiebreaker, the final diagnostic pillar detailed in the text, the tongue.
The tongue is considered the most reliable gauge of the body's internal landscape because it is an internal organ that we can easily observe on the outside.
Right, it's just hanging out there.
Exactly. It is constantly bathed in bodily fluids and deeply rooted in the digestive tract.
The texts explicitly map out how the meridians tether the internal organs directly to the tongue. The heart meridian travels straight to the root of the tongue. The spleen meridian spreads across its lower surface, and the kidney meridian terminates right at the root as well.
When observing it, practitioners draw a strict physiological line between the tongue proper, which is the muscular body itself, and the tongue coating, which is that mossy layer on the surface.
Okay, so they look at both.
Separately, yes. The muscular body reflects the state of the deeper organs and the blood. The coating is a direct byproduct of stomach qi. As the stomach digests food, it basically steams its energy upward, depositing that coating on the tongue.
So a completely healthy, balanced system produces a tongue that is proper size, soft, light red, with a thin white coating.
That's the ideal.
But if the engine is running with empty heat, like we discussed earlier with the teeth, the tongue might be bright red with absolutely no coating.
Exactly.
Because the cooling yin fluids have been baked away, leaving nothing for the stomach to steam upward.
The texts emphasize that while a patient's face might flush temporarily from a warm room, or their pulse might race from anxiety, the tongue changes very slowly.
It's more stable.
It never lies. It holds the true foundational pattern of the systemic disharmony, acting as the ultimate anchor for the diagnosis.
So what does this all mean? When we pull all of these sources together, what we are really looking at is an entirely different philosophy of human existence.
Really.
This system doesn't rely on isolating a single malfunctioning part. It relies entirely on deep patient observation of a constantly communicative ecosystem. Instead of invasive tests, it's just watching. A rot in the root of the tree will always eventually change the color of the leaves.
And this raises an important question regarding how much we ignore our own bodies today. It demands that we slow down.
Yeah, we really don't pay attention.
It forces both the practitioner and the patient to acknowledge that every single inch of the body is speaking a language of heat and cold, of fluid and stagnation.
The interconnectedness is staggering. Just to summarize, the very tip of your nose is broadcasting the state of your digestive spleen. The whites of your eyes hold a microscopic, color-coded map of the injuries on your back.
Mind-blowing.
The tiny veins on a baby's index finger act as a literal alarm system, tracking an invisible battle between a pathogen and the immune system.
It just creates a heightened awareness of what our bodies are constantly navigating.
So tomorrow morning, when you are standing in front of the bathroom mirror brushing your teeth, I challenge you to take an extra 10 seconds.
Just 10 seconds.
Actually look at your tongue, check the corners of your eyes, note the color of your lips, look at the dashboard. Not to self-diagnose an illness, please leave the pathology to the professionals, but just to appreciate the intricate, non-stop signals your internal systems are broadcasting to you every single day.
It's the first step in learning to read your own baseline, well before the engine warning light ever comes on.
And as we wrap up this deep dive, I want to leave you with one final thought to mull over. We talk heavily about the concept of shen the mind or spirit and how prolonged emotional stress physically dulls the eyes and drains the vital essence of the internal organs.
Right.
If our deepest, most buried mental stresses can literally alter the clarity of our sclera, change the tint of our skin, and physically exhaust our kidney energy over time, well, where exactly is the boundary between the mind and the body?
That's the big question.
In a systemic web this intricately connected, does a boundary even exist at all?
Mm.
Or are our thoughts, our emotions, and our physical ailments simply different visible expressions of the exact same invisible energy? Maybe that X-ray machine we talked about at the beginning isn't broken after all. Maybe it's just pointing at the wrong kind of light.